stimulating, inspiring, and educative talk show with Tinu Show. I am Tinu Odununga, and this is a talk show that focuses on tomorrow's brighter Africa. This is a platform where we motivate, empower, and develop the youth and positive minded people around the globe. I am here in Essex with one of a prominent, in fact, a prominent personality, a professor of very outstanding, pronounced, and eloquent. I have been so much, in fact, so pleased. I've been so elated to have the doctor in my program for so long, but I'm so glad today that he has been able to make it. So please join hands and welcome. Hold on, Professor Jayesimi. Do you know one thing? I'm going to read out all those beautiful attributes. You can imagine what I'm talking about. Now, this interview is with our Professor Rotimi Jayesimi. You're going to explain what this is: MBBS, FRSPH, FWACS, FRCOG, MBA. I think I'm familiar with that. And then we've got LLM. Wow, this is wonderful. And then you're also, I think, a member here, Associate Medical Director for Patient Safety and Consultant, Obstetrician and Gynecologist, Basildon University Hospital. And that's in Nexus. Wow, Professor, you've been very busy with your brains and books. I welcome you.
Thank you.
Please introduce yourself.
Yeah, thank you for having me on your show. I'm Rotimi Jayesimi, currently the Associate Medical Director at Basildon University Hospital.
Okay.
I'm also a consultant in obstetrics and gynecology. And in addition to that, I'm a visiting professor at the University of Sunderland in Tyneside.
All right. So, have you been in Sunderland before joining Basildon, or how did you?
I worked and lived in Newcastle for about 20 years.
Newcastle?
Yes, up till 2012.
Okay.
And as a professional move, I decided to come down to Basildon in October 2012 to take up the position of Associate Medical Director for Patient Safety, and that's why I'm here.
So that's why you have so much accumulated attributes to yourself.
Attributes. I think it's one of those things that you have to do.
I think with someone who has got the brains. Well done, well done. I welcome you, like I said.
Lovely, thank you.
Now, what is the role of a gynecologist?
A gynecologist is a trained specialist. After your 5 years of medical school, the National Youth Service Corps house job, then you choose a specialty, and gynecology is one of the specialties. Now, for gynecology, it's about problems that women encounter, especially in reproductive health. So it is, gynecology has to do with reproductive health, menstrual issues, issues of the menopause, issues about getting pregnant, things about abortion, and so many things. So it's just about women's reproductive health.
All in a bowl of salad.
That's correct.
That's wonderful. So you're very familiar with a woman and the body.
I would hope so.
That's great. Now, there's something I'd like to add to this discussion.
Yes.
What exactly makes you wake up in the morning and go to your working place? What makes you wake up and go to the clinic? Would you say you love the money? Obviously, I can imagine. And another thing that I like to know is that, is it a job you so much enjoy doing because you love these women? Or would you say just the money?
No, it has nothing to do with money. If it's money, I'll be in the banks or in the city. I think it's the pleasure that you give to women. When you see women happy, when you see a mother have a childbirth, it's that satisfaction of knowing that you can help them bring a child into life. Yeah. And again, people come to you with medical problems. You treat them and they get well and they're happy. One good thing about obstetrics and gynecology is most of our patients are not very ill. They haven't got those chronic, debilitating illnesses. So they're fairly healthy people, but with problems that can be
resolved.
Yes,
That's great.
So that satisfaction in helping people is what gets me out of bed every morning.
That's great. Do you know what? It's nice to sit down as an experienced person today. But the first day you saw a woman delivering a baby, I mean, the first thing you had to put your theoretical experience into practical, how did you feel? You were being called, doctor, a woman is giving birth. Were you nervous?
You probably want to tell my age now. Because I'm sure the very first time I saw a woman give birth must have been sometime in the 70s.
Wow.
Probably mid-70s, about 76 or 77. And it's a special moment. It's a joyous moment when a mother gives birth, baby comes out, cries, healthy, and everybody around the family are there and they're
excellent.
So I think it's a joyous moment. It's something you cannot explain unless you experience it.
I understand. Yeah. I'm a mother. I understand. That's wonderful. That's great. Now, there's something I'd like to talk about too. You know, we hear about some women today who have been waiting for so many years. Some wait for over 20-something years to have a conception, to conceive, but it's difficult. Let's ask the doctor what he thinks about that. What advice has he got for those who are looking forward to have babies? What would you like to say?
Specifically what you're referring to are couples who have difficulty having babies.
Yeah.
Usually you would expect that a healthy couple within a year of active intimacy will be able to have a baby or get pregnant and later on go on to have a baby. But after 12 months of trying, if there is no conception, then that's when people tend to seek help.
Okay.
There are various causes of infertility. That is the inability to have children. And both partners, it could be due to the man, where the sperm count or the sperm quality is not good enough. Then you could also have female problems, where the woman is either not ovulating every month, that is not producing eggs, because you need eggs and the sperm to come together before fertilization occurs, and that grows into the baby. You also need the tubes of the woman to be healthy, but if it's damaged, for example, due to chlamydia or gonorrhea, and the tubes are blocked.
So does that affect the tube blocking?
It does.
Tube blockage.
Sexually transmitted infection.
Really?
Is a leading cause of infertility.
Sorry, go on.
Yes, and there are other issues such as very rare issues that deal with the endocrine systems, the hypothalamus.
What?
Hypothalamus.
So could you, we use those medical terms.
That's one.
Hello, doctor. Sorry.
That's
could you just try to bring that down to A, B, C?
Yeah,
that's a very big French word.
No, it's a part of the brain. Yeah.
A brain.
Yeah.
I was thinking of something about the tummy. You see?
No, not at all.
All right then.
The woman's body is very complex, and reproduction
Definitely.
is very complex, and you need different parts to come together to be functional. Talking about not ovulating, one of the issues you could have is a situation where the eggs don't get to maturity, and they remain as tiny little eggs, and that's a condition we call polycystic ovaries. Many.
Poly, all right.
Yeah, cystic. As in says, ovaries.
Polycystic. Oh,
Yeah,
I got that right.
polycystic ovaries.
All right.
Yeah.
Okay.
And patients like that do not ovulate every month. They don't have periods every month.
All right.
Some of them tend to have a very high body mass index.
Okay.
But these things are treatable.
Okay.
Yeah.
So that the women would know the treatable
Yes.
issues from the ones that are major. What happens in situation where the man and woman are healthy? A situation where both of them are able to have where they're able to have a child, but there's no conception.
Right, that's what you've said, where both of them are healthy.
Both of them, there's nothing wrong
So
with them.
they've had
medically.
they've had investigations,
All that.
and we can't find anything.
They've done some treatment. They've
Yes.
gone for several treatments.
That's what we call infertility of unknown cause, or idiopathic infertility. And in situations like that, you have to treat. You either have to give the woman some drugs to take, such as clomiphene, and that stimulates the ovary to produce more eggs. At times that is successful. If that is not successful, and perhaps you think there might be an issue with the sperm, you may also do what we call intrauterine insemination. That is when you take the man's sperm and inseminate it, that is, you inject it directly into the womb of the woman, yes.
All right. So is that similar to the procedure where they extract some sperm from a man and freeze the egg for some time? You know, they freeze the woman's egg and the sperm, they put it together?
That's like
either incubator or in a freezer, or in a tube?
the very first one I explained, the intrauterine insemination, is a simpler way of treating unknown infertility or unknown cause. The other one you're talking about is what people call the test tube baby.
Oh, wow.
That's more complex. That's in vitro fertilization. In that, you have to give the woman injections so that produce a lot of eggs. And when you get a good harvest of eggs, then you collect the eggs.
Okay.
On the day of collection of the eggs, you collect the man's sperm, and then you put them together in a dish, and you expect the sperm to fertilize the eggs.
Oh, right.
Now, when you get to the embryo, then you can now use them.
That.
Usually you use two, in some countries
And
you
then
just
put it
use
back
one.
in the womb.
That's correct, yes. And extra embryos can be frozen for use at a later stage.
Later stage, not
correct.
destroyed.
No,
Oh,
not
that's,
destroyed.
I don't know. You know when you said they could be collected in a dish?
Yeah.
You make it sound, palatable.
Well,
But that's
it's
not nice.
no,
It's
it's
really- I don't
people
like
talk
that.
about test tube.
Yeah, but you know the way you said it.
It's
A
okay.
dish. I want our audience to understand. We're not talking about a palatable dish. We're talking about a medical dish.
It's a bowl.
A bowl.
It's a petri dish.
Alright.
Yes.
All right, doctor. I'm learning. I might become a doctor one day.
You've got the brains.
I think so. We're going to go for a break. When we come back, we're going to talk about fibroids in women. Doctor? show, and I've got our Professor Rotimi Jaisimi. Before the break, we spoke about methods that can be addressed when you are facing some issues with a delay in conceiving. You've heard about collecting the eggs and the sperm together, putting it in a dish, and then freezing it. When it's ready, the embryos are being used, and then the other embryo is being kept for future need. Now, and then I promised to talk about fibroid. Wow, that is a very sensitive topic, and it's not easy for some women. I've had a trace of fibroid several years ago, and I can assure you it's not easy. Now, what would you say the damage for fibroid can have in a woman?
I'll first of all explain what fibroids are.
Yes.
Fibroids are simple growths within the womb, within the muscle of the womb. They are rarely cancerous. Very rare will you find fibroids becoming cancer. So they're simple growths. And they are very common in that well over 50% of women will have some form of fibroids. Now, for some people it causes problems.
Yeah.
In that they present.
So delaying conception, you mean?
The commonest problem will be heavy periods, where
continuous periods.
Continuous and heavy.
Yes.
They do bleed heavily.
That's true. Yeah.
Because of the fibroids.
Really? So it's like fibers, like threads, isn't it?
No, they are muscles, just like muscles. Like a ball. Yeah, they are round in shape, but they are all made of muscles. And it's because you've got the fibroids, the uterus